what I want to do is talk a little bit about the Florida Association of ACOs. How did it get started? How long have you guys been around? And really, what was the premise and the goal that you all were trying to accomplish? And what have you seen in terms of that growth over the years?
Well, we started FLAACOs back in 2013, right at the beginning of, MSSPs being launched through the Affordable Care Act. It was a new space. I called it the Wild, Wild West. It needed to be harnessed in. We needed to create a marketplace or a network of those folks that were kind of leading the charge and the early adopters of these ACO models. And so, the few of us that were leading the early ACOs in the state of Florida got together, formed the Florida Association of ACOs. And from that time to now, we've grown this community to, everybody doing value-based healthcare in the state of Florida and beyond. We throw a big conference every year that really, has the best education, the best networking, I think the most fun. And we accomplish things. I think some of the first commercial contracts that were crafted around value-based healthcare were done through connections made at the conference. I think innovation, technology that really didn't exist at the beginning, we started to see it come through the conference. It really has built a strong value-based healthcare community. And I think a testament to that is that Florida really is one of the most successful ACO marketplaces, value-based healthcare marketplaces in the country.
Well, I think that was a great transition to Texas, right? So when you look at Texas, from a demographic perspective, from an independent physician perspective, certainly some system-led organizations that are playing around from the early days of Pioneer into Next Gen. But from the current operating environment, I feel like it just made sense to look at Texas as the next market. And what's been exciting for me is how quickly we've been able to capitalize on the good work you've done in Florida. So I'll give you an example. I travel the country. I do tons of conferences. I'm all over the business of healthcare. What really stood out to me about what you've created in Florida is that these are real best practices, real stories, real operators. It's not policy. It's not granola, vanilla. The takeaways are, here's what we're doing. Here's what works. What have you seen? How do we pull it together? How do we make this better? And I love the mentality of that. We're somewhat competitive in this room, but by and large, the number one problem is fee for service, and that's the enemy. And I love that mentality. And so as I've seen that grow, and even, 4 or 5 years ago, it was still very kind of, ACO heavy, but then you started to see all of these other innovators that have come in. And the fact that Texas was able to hit the ground running and capitalize on that, this has become the epicenter of where value-based care is, not only in Texas, but I would say from a national level, because there's a lot of Texas people in this room, but there are a lot of folks here from all over the country. And so that innovation and that excitement and that energy, I think, is what breeds all of this connection.
Yeah, I think to your point, Texas felt very much like Florida, and it is a big, giant state. It's got a lot of physicians, members, innovation, and yes, there were some big hospital systems that dominated, but I think there is a spirit of the independent here, which will lead to a very, very successful market. One of the things that I thought was super interesting is that the delta on success in the state of Texas is incredible. It's one of the most successful states as far as shared savings in comparison to the national average than almost any other state. I'd say Florida probably fits in that model too, so similarities there. But as far as who's here, absolutely. This is an interesting year because we've got CMMI rolling out so many new models. You can see they're really thoughtful about what they're doing, what they're launching. They've listened to communities like ours in Florida and now in Texas, and I think they're incorporating that in what they're rolling out. And you're seeing the solution providers get ready for it. They see it coming. They know there's new capabilities that are needed. And so they're building them. They're here. And I think what's always been interesting about FLAACOs and now TACOs is that this is a convergence of those best-in-class solutions. And you don't have, the big conference solutions that just rebrand their products. These are founders. These are folks that are innovating and building product and really listening to these sessions and saying, okay, I hear the problem and I'm here to fix it. And they roll out solutions timely and for what's coming next, not just rebranding stuff that they've been trying to sell for years and years. And then as far as the community, a state-based organization is different than a national organization. We both are needed, but we listen to the problems that are particular in this state. And in Florida, in Texas, those independents who are successful in the ACO model are still trying to get leverage on the commercial side. and even on the Med Advantage side, and so a community like this can really help that. And then as Medicaid starts to get into the game, we're there to support that and to be a voice and an advocate for what's happening at the state policy level. So you can only do that with a state organization. And so for all of the things you said and I just said, it just makes sense for us to be here.
This is Texas. So we have, unfortunately, we have one of the highest populations of uninsured patients in the country. We have the lowest acceptance of Medicaid. You don't see a tremendous amount of managed Medicaid. I've had 2 Medicaid conversations today. So they're in the room. I've talked to ACO operators. I've talked to IPAs and CINs. I've talked to health system operators. We've got Southwest Health Resources in the room. We've got Baylor Scott and White in the room. I've talked to private equity. I've talked to venture capital. I've talked to solution partners, technology. Everybody is coming here to figure out where do we need to go to move this model forward. And that's what's been exciting for me.
Yeah, I agree.
Well, tell us a little bit about what's coming up this fall. So let's pivot from Texas and let's start talking a little bit about Florida. I'm excited to come down and spend a few days in Orlando. So when is the conference and how do people find out?
So the conference is November 9th through the 11th. It's in Orlando. We've got all these new models rolling out. We're going to learn a little bit more. We're going to know who's already participating in some of them. We're going to have probably some lessons learned, some things that, will continue to help us be better. We're going to have more innovators, more solutions. They're just going to be a little more mature. And so, and Florida, has been around. We've been doing it for 14 years. And so we've got a little more seasoned group there. And I think now that we're this community of FLAACOs and TACOs, I think there's going to be some cross-pollination. And so you're going to see both communities come together. So I think it's going to be an exciting, bigger and better every year kind of thing. And just more the same, but, the same is good stuff.
Yeah, I love it. Well, and I think the cross-pollination is great because one of the things that, we talk a lot about from a board perspective and when we stood this up is how do we bring a collective voice to value-based care? So certainly kind of in the ACO roots, but more of a broader base of value-based care. We're looking at some of the new models. One of the things I'm really intrigued about is the commercial payers. How do we bring the commercial payers to the table to have a conversation? Because my challenge, even going back to the days of being in the IPA CIN world, is they're all looking at their cost. Their levers are all different, and to some degree, they're always moving the goalposts. And so I'm really excited about the payer panel today because I think they're going to share from their perspective how they view the lens. And I think that aligns with what we as operators need to do to bring them in. And so a good friend of mine would say not to call them out, but to call them in. And so I think that's where we're going to go and be able to pull that in.
Well, to that point, that's what happened in Florida. So we, in the early days, really the commercial payers had no idea even to execute on a value-based healthcare contract. And so they came and we asked them, leaders within these organizations to come and tell us your strategy. How are you even looking at this stuff? And through those conversations with us, with each other, and through, getting some feedback, we crafted some of the first commercial VBC contracts. And because of that, they're pretty good in Florida. So that cross-pollination that we're just talking about, hopefully will take, because a lot of the big payers are the same payers.
Right.
And so what they're doing here, once people know what they're doing there, maybe we get some traction and get some better contracts here in Texas. And so that's where, it comes into execution. So,
well, it's going to be exciting. Look forward to getting down there in November. I do want to take a small pivot. I'm really intrigued. I know enough to be dangerous, but not enough to be intelligent. It's on the sign, a Value H organization for TACOs, a Value H organization for FLAACOs. What is Value H?
So, once we decided to go into a second marketplace, I thought, okay, we are 2 state-based organizations, but we are cross-pollinating, like we said. We've got synergies. And so how do we create one entity, Value H, that kind of brings everything together, but still recognize that this is not a national organization. It's still an organized, cross-pollinating, synergistic thing that enables these state-based organizations to thrive. So it's FLAACOs, it's TACOs, could be the Northeast, could be the Mid-Atlantic, could be somewhere in the Midwest, who knows? But we definitely are going to other places. And so we see the need, we see the power, and so we just got to pick the right markets. I will say that we tend to lean more towards those independent physician-led marketplaces just because we know how successful they can be. And so that's probably where we'll go next. And it really just is about finding people like you that are leaders in the community that can help us pull it together and go make it happen. So,
well, what we've been able to accomplish in Texas over the last 2 years, kind of taking the best practices from FLAACOs and hitting the ground running, I think wherever it makes sense to plant the flag next, is going to be able to capitalize on all of that momentum, and let's just keep it going until we finally break the system and the fee-for-service chassis and really find a way to reward outcomes.
That's the plan. And I love that fee-for-service is the enemy, not each other. We're collaborating. We're trying to figure out how to make value-based healthcare the only model.
I love it. It should be, right? It should be. Well, we're having a great time here at TAACOs, and definitely want to see you down in Florida, Orlando, November 9th through the 11th.
Through the 11th, yeah.
Look forward to it. Thanks so much, Nicole.
Pinnacle is your partner in the business of healthcare, nationally recognized for helping clients manage risk, improve performance, and drive innovation. For more information, visit our website, askphc.com. For more information on our guest or to learn more, please visit their website.